does not. With that, Mr. President, I thank you again for the opportunity to discuss the differences and to try to find some common ground on this.
Well, listen, this has been hard work, and I want to first of all thank everybody for being here and conducting themselves in an extraordinarily civil tone. And as I said, given the number of folks that were around this table, the fact that we're only an hour late it beats my prediction. About 10 minutes. I want to go through where I think we agree, and I want to summarize where I think we disagree. And then I'll address some of the process issues that have been brought up by a number of the... we agree, we don't, but we agree on some of them. I think that if you look at the ones that we don't agree on, since there's been a lot of reference to what the American people want, it turns out that the ones that are not included in the Republican plans right now, but are included in the Democratic plans, are actually very popular. I know there's been a discussion about whether a government should intrude in the insurance market, but it turns out that on things like capping out-of-pocket expenses or making sure that people are able to purchase insurance even if they've got a pre-existing condition, overwhelmingly people say the insurance market should be regulated. And so one thing that I'd ask from my Republican friends is to look at the list of insurance reforms and make sure that those that you have not included in your plans right now are ones, in fact, that you don't think the American people should get. Because I strongly believe in these insurance reforms. I've talked to too many families who have health insurance and find out that what they have does not provide them with the coverage they needed, and they end up being bankrupt, or they end up going without care, or they get care too late, as was the case in the story that Patty Murray mentioned. The second thing I think we agree on is the idea that allowing small businesses and individuals who are right now trapped in the individual market, and as a consequence have to buy very expensive insurance and effectively oftentimes just go without insurance, could be solved if we allowed them to do what members of Congress do, which is be part of a large group. Again, the idea of an exchange is not a government takeover. It is how the market works, which is if you have a lot of purchasing power, you get a better deal. That's how Walmart drives its prices down, because everybody who wants to supply Walmart, Walmart tells them, you give me the best deal possible. And as a consequence, the supplier gives them a much better deal than they do the mom and pop shop in the corner. Well, we should be able to give small businesses and individuals who are self-employed, who aren't able to get insurance through a large employer, to have that same deal. It sounds like we've got some philosophical difference as to whether there should be some minimum benefits in that exchange, some baseline of coverage. Again, there's a baseline of coverage for members of Congress, and the reason we set that up is because we want to make sure that any federal employee who's part of this big pool is getting good quality coverage. Not perfect coverage, not gold-plated coverage, but adequate coverage. It may be, and I'd ask my Republican colleagues to look and see, is that an area that can be resolved? There's been a lot of discussion, and one of the main tools the Republicans have offered to drive down costs is purchasing insurance across state lines. This is an idea that is embodied in the House and Senate bill, but again, the details differ. The approach that John Boehner and some of the Republicans appear to take is to say, let's just open things up. Anybody can buy anything anywhere, regardless of what state insurance laws are, and that will drive competition and cost. The philosophical concern I have on that is that you potentially get what's been referred to as a race to the bottom. And for people who may not be following the intricacies of the insurance market, let me give an example that people understand, and that's credit cards. In the credit card market, part of what happened was we ended up allowing people to get credit cards from every other, whatever state, and there were a few states that decided, you know what, we're going to have the least restrictions on credit card companies that we could have. And what ended up happening was that every single credit card company suddenly, lo and behold, started locating in that state which had the absolute worst regulations and consumer protections. And all these fees and practices that people don't like, folks weren't happy about. So the question I'm going to have is there a way for us to deal with the interstate purchase of health insurance, but in a way that provides, again, some baseline protections? Because what we don't want is a race to the bottom. We want everybody to have the basic protections that make sense. And that's not a big government takeover. That is a standard thing that we do in almost every area of life. We protect people with respect to the food that they buy, with respect to the drugs that they purchase. We license and regulate the medical profession because we don't think anybody should just be able to cut somebody open. We want somebody like Tom or John to actually know what they're doing before they start practicing medicine. And the same should apply when it comes to how we think about insurance. Medical malpractice has been mentioned. Now, look, let me be honest. This is something historically that Democrats have been more resistant to than Republicans. I will note that when we had a Republican president and Republican controlled the House and the Republican controlled the Senate, somehow it didn't happen, and I'm surprised. But
we needed 60 votes in the Senate, too,
well,
Mr. President.
See there? So as a consequence, what I have suggested is that we explore, building on what we've already done administratively without law, asking Kathleen to help states come up with new ideas. I've suggested, well, let's take a look at, Tom, the suggestion you had that gives states even more incentive to start thinking about reducing defensive medicine. I have to tell you, Joe Barton, that how you got from $5 billion to $150 billion, I didn't quite follow the math. It sounded, I'm not sure you did either, but it's okay. But here's my commitment, is that if folks were serious about getting this done, I'd be interested in seeing if we could work on something. I actually agree with Dick Durbin with respect to hard caps because of the story that he told about the woman who burned her face. I think there are situations in which there is actually a very severe problem. And I would distinguish that between some of the frivolous lawsuits that are out there that really do create a defensive medical problem. And OB-GYNs are the ones who get hit the hardest because people are so sympathetic when a child is born with severe disabilities, and it can just be crippling on OB-GYNs. The same is true for neurologists and so forth. So there may be some ways that we can work on that. Now, I guess what I'm saying is I've put forward then very substantial ideas that are embraced by Republicans. Peter, they're not, I forget what metaphor you used about before you popped it in the microwave, whether it was bacon bits or sprinkles or breadcrumbs. That was what it was. When it comes to the exchange, that is a market-based approach. It's not a government-run approach. There were criticisms about the public option. That's when supposedly there was going to be a government takeover of health care. And even after the public option wasn't available, we still hear the same rhetoric. And it turns out that what we're now referring to is we have an argument about how much we should regulate the insurance industry. We have a concept of an exchange, which previously has been an idea that was embraced by Republicans before I embraced it, and somehow suddenly it became less of a good idea. With respect to the most contentious issue, I'm not sure we can bridge the gap, and that's what we're going to have to explore, and that's the issue of how do we provide coverage not only for people who don't have health insurance right now, but also for people who have pre-existing conditions and are being priced out of the market, or potentially lose their jobs and will find themselves in a situation where they don't get coverage. An interesting thing happened a couple of weeks ago, and that is a report came out that for the first time, it turns out that more Americans are now getting their health care coverage from government than those that are getting it from the private sector. And you know what? That's without a bill from the Democrats or from President Obama. It has nothing to do with quote-unquote Obamacare. It has to do with the fact that employers are shedding employees from health care plans. And more folks, if they can, are trying to get into the Social Security system and the Medicare system earlier through disability or what have you, so that they can get some help. The point that Tom Harkin made, the point that Chris Dodd made, the point that Henry made, and a number of other people made, I think is very important to understand. I did not propose, and I don't think any of the Democrats proposed, something complicated just for the sake of being complicated. We'd love to have a 5-page bill. It would save an awful lot of work. The reason we didn't do it is because it turns out that baby steps don't get you to the place where people need to go. They need help right now. And so a step-by-step approach sounds good in theory, but the problem is, for example, we can't solve the pre-existing condition problem if we don't do something about coverage. Now, it is absolutely true, and I think this is important to get on the table, because we dance around this sometime. In order to help the 30 million, that's going to cost some money. And the primary way we do it is to say that, for example, people who currently get all their income in capital gains and dividends, they don't pay a Medicare tax, even though the guy who cleans the building for him does on his salary or his wages. And so what we say is if you make more than $200,000, $250,000 a year, if you're a family, and your income is from those sources, then you should have to do the same thing that everybody else has to do. Somebody mentioned the fact that we say to small businesses, I think John Kyle, you said, you know, we're taxing small businesses. Look, we exempt 95% of small businesses from any obligations whatsoever, because we understand that small businesses generally have a tough time enough. They don't need any more government burden. What we do say is, if you can afford to provide health insurance, you have more than 50 employees, meaning you're in the top 4% of businesses, and you're not providing coverage, and you're forcing other businesses or other individuals to pick up the tab because your employees are either going to the Medicaid system or they're going to the emergency room, we don't think that's fair. So we say you've got to pony up some. It's not an employer mandate. It just says you've got to pay your fair share, because otherwise all of us have to pick up the tab. And that, by the way, contributes to the overall deficit that Medicaid is running. In fact, most small businesses through this program get huge subsidies by becoming members of the exchange. That's where the money's going. The money's not going to some big welfare program. The money's going to give tax credits to small businesses, tax credits to those who are self-employed to buy into this pool. And that's not a radical proposition. It's consistent with the idea of a market-based approach. And finally, with respect to bending the cost curve, we actually have a lot of agreement here. This is an area where, if I sat down with Tom Coburn, I suspect we could agree on 95% of the things that have to be done. Because the things you talk about in terms of, and I wrote some of them down, you know, in terms of reducing medical errors, in terms of incentivizing doctors to coordinate better and work in groups better, in terms of price transparency, improving prevention. Those are all things that not only do I embrace, but we've included every single one of those ideas in these bills. Now, the irony is that that's part of where we got attacked for a government takeover. Because what happened was when we set up the idea of a MedPAC, which is basically a panel of doctors and healthcare experts who would recommend ways to make the delivery system better so that we can squeeze out that 1/3 in Medicare and Medicaid that's wasted, a Republican idea, that was part of the ammunition you all used to say that the government's going to take away your health care. So if we're serious about delivery system reform, if we're serious about squeezing out the waste that Tom Coburn referred to, you should embrace those mechanisms that are in this bill. I will end by saying this. I suspect that if the Democrats and the administration were willing to start over and then adopt John Boehner's bill, we'd get a whole bunch of Republican votes. And I don't know how many Democratic votes we'd get, but we'd get a whole bunch of Republican votes. The concern, I think, that a lot of the colleagues, both in the House and the Senate, on the Democratic side have, is that after a year and a half, or more appropriately after 5 decades of dealing with this issue, starting over, they suspect, means not doing much or doing the proposal that John Boehner or other Republicans find acceptable. And that it's not possible for our Republican colleagues to move in the direction of, for example, covering more than 3 million people. It's not possible to move more robustly in the direction of dealing with the pre-existing condition issue in a realistic way. It's not possible to make sure that we get people out of a high-risk pool and get them into a situation where, as Tom Harkin put it, healthy people, young people, rich people, poor people, old people, sick people, everybody is part of a system that works. That, I think, is the concern. Having said that, what I'd like to propose is that I've put on the table now some things that I didn't come in here saying I supported, but that I was willing to work with potential Republican sponsors on. I'd like the Republicans to do a little soul searching and find out, are there some things that you'd be willing to embrace that get to this core problem of 30 million people without health insurance and dealing seriously with the pre-existing condition issue. I don't know, frankly, whether we can close that gap. And if we can't close that gap, then I suspect Mitch McConnell and Harry Reid, Nancy Pelosi, and John Boehner are going to have a lot of arguments about procedures in Congress about moving forward. I will tell you this, that when I talk to the parents of children who don't have health care because they've got diabetes or they've got some chronic heart disease, when I talk to small business people who are laying people off because they just got their insurance premium, they don't want us to wait. They can't afford another 5 decades. And the truth of the matter is that politically speaking, there may not be any reason for Republicans to want to do anything. I mean, we can debate what our various constituencies think. I know that I don't need a poll to know that most of Republican voters are opposed to this bill and might be opposed to the kind of compromise we could craft. So it'd be very hard for you politically to do this. But I thought it was worthwhile for us to make this effort. We've got a lot of other things to do. I don't think, Tom, that we're going to have another one of these because people don't have 7, 8 hours a day to work some of these things through. What I do know is this: if we saw movement, significant movement, not just gestures, then you wouldn't need to start over because essentially everybody here knows what the issues are. And procedurally, it could get done fairly quickly. We cannot have another year-long debate about this. So the question that I'm going to ask myself, and I ask of all of you, is there enough serious effort that in a month's time or a few weeks' time or 6 weeks' time, we could actually resolve something? And if we can't, then I think we've got to go ahead and make some decisions, and then that's what elections are for. We have honest disagreements about the vision for the country, and we'll go ahead and test those out over the next several months till November. All right? But I very much appreciate everybody being here. Thank you for being so thoughtful, and hopefully we'll all keep our constituents in mind as we move forward. Thank you, everybody.
Something over 6 hours and 22 minutes worth of meetings. The Bipartisan Healthcare Summit at Blair House is over. And as you can imagine, there will be lots of reaction and media coverage over the next few days in the blogs and news sites and here at C-SPAN. But right now, we want to hear what you think. Was this summit successful? Was it necessary? Did the members of Congress and the president talk past or to each other? And was progress made towards health care reform, or is that not even necessary in your view? And as the president asked, what's the next step? Let us know what you think. Go ahead and phone in at the numbers on the screen. 202 is the area code. 624-1111 for Republicans, 624-1115 for Democrats, and 624-0760 for Independents. Or you can send us a tweet at twitter.com/cspan and join our discussion forum on Facebook. Facebook.com/cspan. We've gotten already over 1,000 comments on Facebook. A lot of people are interacting with each other on that site about this healthcare summit. And let's start here with this tweet. This is from Michael Cheney. And he tweeted in that he was very interested in healthcare, then was very cynical, but he now thinks the public can be brought back around. And our first call comes from Marie in Argyle, Texas. On our Republican line, I would just simply note also that both the Democrats and Republicans will be holding press conferences. We'll be bringing those to you live this afternoon as well. Go ahead, Marie.
Thank you for taking my call. I think this issue is about consumer protection, and that was brought out in multiple statements today. Once again, I heard rhetoric from the Republican side, and I have been a Republican since I started voting long ago. I'm really disappointed in their rhetoric. I saw much more of specific ideas and staying on topic from the Democratic side.
Marie, could you tell us one reform you'd like to see in health care then?
One reform?
Yes, ma'am.
Pre-existing conditions.
All right. Did you see agreement at this summit about that issue?
I did not.
All right. Thanks for calling in. As you can see, the Democrats are walking over to the White House, which is across the closed Pennsylvania Avenue area from Blair House, and they will be coming in up to the White House driveway and holding a press conference. We will come live to that as soon as it happens. Sylvia, Rockledge, Florida, you're on the air, Democrat.
I'm calling because I think it was a very useful summit. I commend President Obama for bringing the bipartisan groups together. I don't think they reached an agreement on the Republican side. The one reform that I would love to see also is the pre-existing condition. I am an employee of the federal government contractors. I would love for us to have the same benefits as the federal employees with the savings plan. My health is just as important as anybody else's health.
Sylvia, do you think the Democrats should push forward and try to get some kind of health care passed, even without Republican participation?
I think all parties ought to represent all constituents of this country.
Thanks.
And I think there was an effort made on the president's behalf, and I think they should all be willing to work with him.
Dominic, Brooklyn, Independent Line. What'd you think about the summit?
I thought it was a farce, to tell you the truth.
Why?
I think the president, to me it seemed like he was the judge, and there was two sides, and he was siding on the Democratic side, which naturally is a Democrat. But what I'm trying to bring out is they have all these good ideas that they say they both in favor of. Why not just throw everything out like the Republicans are saying and just start with all the things that they agree on and then go page by page through those 2,027 pages, and what's good, what they can agree on, put in it. What is no good, throw it out. What's so hard about that? They put this bill together in how many months? So what's another month or two for them to go through it and do it right and have everybody participate and put whatever's good, which whatever they agreed on together, put that on the sheet, put the next thing on the sheet, and then go through the sheets that they don't agree and see what happens.
And we got this tweet from Nikki. Obama very smart to have this summit. American people now heard both sides. Doug, Republican, Melbourne, Florida.
Yeah, thank you for having me on. I guess I didn't get anything out of it, and I don't think they really got anything out of it. Both sides are still, it's too partisan. Nobody's listening to the other side. Nobody's listening to what the Americans have to say. Our voices aren't being heard. So I guess maybe I feel that, things like tort reform and stuff like that should have been put on the table right then, but they didn't do anything. There was nothing done overall everything, and it's just kind of sad. It shows what's going on up there. It shows what, if you hire somebody to come and clean your house and they don't clean your house, you fire them. You hire somebody to go to help you in Washington and they don't help you, you need to fire them. We need to fire the whole bunch of them.
Michael Anthony tweets in, this is just part of the process of, quote, building a box, end quote. Dems are positioning for reconciliation. This is a display of tactical genius. Phoenix, Becky, Democrat, you are on C-SPAN. Tell us what you think of the healthcare summit.
Well, let me tell you, I thought it was wonderful in that I got to learn a lot. First of all, I think what President Obama did was genius by having this summit. We were able to see where the Democrats, what views they're representing and what they're putting into this bill.
And you know what, Becky? Here are the Democrats coming out to the stakeout in front of the White House. Let's listen.
Okay.
Wait, no. Wait, freeze.
Not a long time.
Chill.
Rhea?
Freeze.
First of all, the most patient man in the world is Barack Obama. He sat through that and listened to everything and was so patient and responsive. It was an issue-oriented meeting. The president let everybody talk and talk and talk. And I think that there's so much agreement, but yet every Republican used the same talking points. Every member of Congress used the same talking points. And we want to do a bill for the American people. And we're going to continue to work very hard. We're ready to do it. The president said we have to do something very soon, and I agree with him. But we're willing to work with them. But time is of the essence. American people waited 5 decades for this. It's time we do something, and we're going to do it. Madam Speaker?
Thank you, Mr. Leader. I agree with the distinguished leader. Our president is indeed a great leader in that he has a vision for our country and about how we move forward with health insurance reform. He is striving to build consensus. He is listening for any common ground and extending an invitation for that. And so I'm hopeful that something may come of it. I'm not overly optimistic that we would get Republican votes for the bill, but that doesn't mean we couldn't incorporate some of their good ideas into legislation should they put some on the table. The president 1 year ago had us all here at the White House, March 5th, where he had his health summit, which was bipartisan at the time, and began the debate which over the past year within the committees of jurisdiction and in the Congress, he has sought bipartisan support that continued until today. I hope that something will come of this. I use the analogy of the kitchen table. As we sat around the that table in that room, we have to represent the aspirations of Americans as they sit around their kitchen tables, concerned about their jobs, the education of their children, as well as their health care costs and how they're going to pay their medical bills. Those people who are, again, struck with illness or pre-existing conditions and the rest want us to act. They want results. We can't say to them at the end of the day, well, we had an idea, we had a vision, we had a majority, but the process did not allow us to make a change for your lives. We need to have the courage to get this job done, and we will. And I think today took us a step closer to passing health care, to improve health care, to lower cost, and to make it much more accessible to many more Americans. I salute the President for his leadership. Mr. Durbin? Mr. Durbin? Oh,
I just want to make 2 points. First, to thank the President for bringing us together. It was a long day, and it was a day where he was open to everyone's comments. There were 2 things that came through clearly to me. First, though we agree on many basic things, we feel that any bill that is going to serve the American people has to have the kind of regulation of insurance companies so that people understand that when they buy a health insurance policy, it will be there when you need it. The whole issue of pre-existing conditions. If we allow the insurance companies to turn Americans down by the thousands and hundreds of thousands because of pre-existing conditions, we're not going to give them the peace of mind and security that they need. Secondly, I looked around that room and realized that virtually every member of Congress in that room is part of a health insurance exchange run by the federal government with imposed minimum standards on the health insurance companies. Our Republican friends who find this so objectionable for the rest of America live with it every day. We should offer to the American people the same kind of health insurance coverage that we enjoy as members of Congress.
Thank you. Stony Hoyer, the Majority Leader of the House. I've been in the House for almost 30 years. I've lived in the Washington area for a long period of time. I cannot remember a similar event. I cannot remember a President of the United States spending an entire day sitting with some 30 members of Congress discussing an issue, displaying an extraordinary depth of knowledge of that issue and an extraordinary passion to accomplish the objectives of that legislation. My view is that this meeting was worthy of the objective we seek, worthy of the objective of including all Americans with access to affordable health care. You've heard that mantra, but that is reality. And what we saw in that meeting was a difference, a philosophical difference, a difference of scope. One party, the Republican Party, having a bill which essentially includes 10% of those who are uninsured. And we believe that all Americans needed to be included. That's a substantive difference, but there were also areas of agreement, and we pointed those out. And many of the areas of agreement that Republicans sought have already been included in our bills. We hope that based upon this discussion, we can move forward. But move forward we will to accomplish the objective that all of us, including the President of the United States and including John McCain, said were the objectives of including every American. And that is the phrase of John McCain: every American in affordable health care.
Is the ball in the Republicans' court now?
What do you mean by that? The fact is that we are going to move forward. The ball is in everybody's court to try to find some common ground on how we move forward. Mr. Durbin pointed out the defining difference that emerged in this meeting, though, and that is in order to make the changes, in order to end discrimination on the basis of pre-existing condition and all the reforms that we want to make, in order to hold the insurance companies accountable, there has to be some regulation of the insurance industry. That seemed to be the big separation between the Democrats and the Republicans. Whether that can be bridged remains to be seen. My colleagues, does anyone want to? Oh, they left.
How can you find common ground, though, if Republicans are saying the only way to move forward is to start over?
Well,
it was what they were saying before this.
First of all, one of the first speakers was Dr. Coburn, and he laid out this very logical approach as to what should be done with health care. The President came back and said, "That's interesting. Everything you've talked about is in our bills." So, if logic has anything to do with reaching agreement, it should be pretty easy.
Good leader, Reed.
Thank you. Thank you. Thank you.
Let's get warm. And we continue to take your calls, and we'll be joined shortly by Mary Agnes Carey of Kaiser Health News to get her perspective and to get her reaction to the 6.5 hours of Health Care Summit. By the way, if you want to join one of our discussion forums and you can't get through on our phone lines, you can go to facebook.com/C-SPAN, no dash in C-SPAN. Big discussion forum going on right there in real time. And also, we're getting a lot of tweets. And if you want to follow what everybody is saying and perhaps respond to some of the tweets, you can go to C-SPAN, hashtag C-SPAN-HC, the HC standing for healthcare, of course. And in fact, here's a tweet that we got from Mike Ritter. Healthcare Summit, good layout of why issues are important. Whole process should have been like this. As we wait for the Republicans to come out in their post-summit press conference, we'll take this call from Tacoma, Washington. Dave, independent line. Do you think this summit was worth it, Dave?
To a point. You have a lot of Republicans agreeing with 90% of what's in the bill that the Senate and House have put forward. I'm one of these people that have been unemployed. I'm not eligible for Medicare or Medicaid. Because of my unemployment, my wife works for a major health care provider. She can't afford to put me on her health insurance. I spent 4 days in the ICU from drug-induced diabetes. And then 5 months ago, I had a mild heart attack, 10% blockage.
Right.
We've got $20,000 worth of medical bills that we can't afford to pay.
Dave, one reform you would like to see.
I would love to see single payer. Single payer only makes sense. Is the only thing that makes sense.
Orlando, Florida, Gerald, Republican. What do you think? Gerald, you with us? Whoops. We went to Inverness, Florida. Sorry, William.
Afternoon, sir.
Hi.
My comment on this whole thing is I saw a lot of people there at the table at the conference look like they were campaigning for themselves. Number two, my aspect on this whole thing is we put them in office. We pay for their health insurance. We pay for their salaries. If they're so worried about health care and getting it right, let's just go to the same exact program that they're eligible for. Offer it to the people of the United States. I'm a Democrat, but I vote across party lines if I feel there's a candidate that represents our interests and the best of our country. And I think that's what we need for this country. Everybody has the equal opportunity to take and go ahead and purchase insurance at a reasonable cost where it doesn't take and cause you to go broke. My wife and I are both disabled. We do not have insurance. We pray to God that we don't get sick or have to go to the hospital.
All right. Thank you so much. We appreciate that. Mary Agnes Carey of Kaiser Health News. What struck you the most about this afternoon session of the Healthcare Summit?
Well, I think that both sides were trying to get across their points, but President Obama kept trying to get a focus on where they can agree. He did at the end summarize where he thought there were some points of agreement between the two parties, and he would talk about this through the session, and he would try to bring folks back to where they could agree. For example, the idea that you do need some insurance market reforms. He tried to say to Republicans, you have also in your bill said no pre-existing medical conditions you shouldn't be discriminated against because of that. You shouldn't have your health insurance canceled because you get sick. But the difference is on how much regulation of the insurance industry. For example, Speaker Pelosi said she thought that was a key difference. Democrats feel very strongly about heavier regulation of the insurance industry. Republicans want nothing to do with that. Again, trying to find consensus, President Obama talked about, we both agree that there should be some sort of exchange, some sort of larger system where insurance plans can come and offer coverage. The President and Democrats want some minimum standards for coverage. Republicans feel that that's too intrusive to have the HHS Secretary set those standards within the exchange. The same idea goes across buying insurance across state lines. Republicans favor that. Democrats favor that. They have different approaches. Republicans would prefer that these plans not have to follow state mandates within a particular state coverage for breast cancer screening, mammography, these sorts of things, where the Democrats would want those state prerogatives guarded a bit more. So I think if you look through all those things, medical malpractice was another area the President talked about. It's very clear that Democrats have no interest in capping medical malpractice judgments like Republicans do, but President Obama said, is there room to work with states to get better approaches? He laid it down on the table. Another key dividing point here between the parties is Democrats and the President think that you need to have an individual mandate that people must be required to have health insurance for all the insurance market reforms to work. Republicans are very much against that idea. So while the president tried to bring folks together, and to be fair, he also took his prerogative of president. He would stop sometimes folks in the middle of their statements or before he'd go to another speaker. He would follow up with points that he thought were important, that why his approach and the Democrats' approach was important. But he did try to say, look, let's figure out where we agree and let's go forward trying to figure out if we can get more agreement. But whether or not that can happen, I think, is extremely unclear.
Agnes, Kerry, very quickly, what is the next step? You've been covering this for a long time. What's going to happen next week?
Well, I think that the Democrats on both the House and the Senate will continue to talk to their members. Earlier this week, they were going through the president's proposal with them. What do you think about it? Basically, they're going to do some vote counting. Will there be votes in the House to pass the Senate package and to pass this second package, reconciliation package of fixes? Will there be, where is the Senate? Do Democrats want to pursue budget reconciliation? Do they not? Where are the votes? There are many people that would like to pass this before they leave for their Easter Passover break, which is at the end of March. So we only have about a month. The president himself said we have to see where we can go in the next month to 6 weeks. So I think next week there'll be much more focus on this, on the next step of how they can move the bill.
And here come the Republicans. We'll get our guest reaction and more calls after this.
Great.
Well, we appreciate the opportunity to meet with the president today and discuss health care. And as he conceded and a number of the majority conceded, there are plenty of good Republican ideas. The core problem is this. We don't think a 2,700-page bill that cuts $500 billion out of Medicare, raises taxes by $500 billion, and drives insurance premiums up is a good idea. What we think you ought to do is start over and go step by step and target the areas of possible agreement that we discussed in the meeting today. Frankly, I was discouraged by the outcome. I think it's pretty clear that the majority, including the president, want to continue with basically the Senate bill, which has even been made more expensive based on the president's recommendations that were put on the internet a couple of days ago. But we're happy to continue to discuss the areas of agreement. It's just that I do not believe there will be any Republican support for this 2,700-page bill that the American people are so overwhelmingly opposed to.
Leader, how do you think? I think the American people want us to work together on common sense steps to make our current system work better. American people are concerned about health care. And there are some areas that we do agree on, that we can work together on to take steps to make our current system work better and bring down the cost of that system. But we can't do it within the framework of a 2,700-page bill. That's why the bill needs to be scrapped. We need to start over on those things that we can work together on to make health care less costly for the American people.
Let me just say one thing quickly. I wrote a note to myself at the end. I just don't think the president was listening, even though he invited us to hear our ideas. He actually consumed more time than all of the Republicans combined or all of the Democrats combined, and much of it was responding to our ideas. So it wasn't a matter of just inviting us down to listen to our ideas. He wanted to argue with us. And there's a reason for it. There's some fundamental differences of opinion. I respect his. I think he indicated he respected ours. But it's not going to be possible with that kind of an approach to come together within the time frame that he indicated if you insist, as Senator McConnell just said, on starting with this 2,700-page bill and then tweaking it to adopt some of our ideas. The whole concept of the bill, with its government mandates, its taxes, its spending, and all of the other features of it, are what make it unacceptable to us and to the American people. And that, I think, is where we have to start.
It sounds like there's a stalemate. So what's the next step?
Well, you've heard what we recommend, that we scrap this bill and start over. We also ought to listen to the public. We know that the average of all of the public opinion polls indicate Americans are opposed to this bill by 55 to 37. Interestingly enough, Gallup just this morning polled Americans on how they would feel about using this little-used reconciliation device, and by 52 to 39%, Americans are opposed to doing that. I think the message is very clear. The American people have followed this issue like no other in the time I've been in Washington. Everybody's interested in their own health care. They do not want this bill. It's time we started listening to the people that we represent.
Senator, was this a waste of time?
I wouldn't call it a waste of time. It was a good discussion. You had in the room, I think, virtually all of our really knowledgeable people on the subject, so I would not call it a waste of time.
Senator, not to be argumentative, it sounds like you think it was a waste of time. You just said to us at the end of an all-day meeting the same thing you said very early on in the healthcare summit.
Right.
And what was gained by all those hours?
Well, the president kept saying the same thing, too. I mean, I think it's pretty clear on this big, important issue, we have very strongly held opinions on both sides, and we think the best way for this to be resolved is to pay attention to the people who sent us here, who were speaking overwhelmingly, saying, do not pass this bill.
I do think, in terms of the meeting, it was worthwhile. It was pretty clear throughout the meeting there are a number of areas that are in agreement. But let's take those issues that are of agreement or things that we can work together on, and let's package those together and do them. But we can't do it in the context of $1 trillion bill that has all these tax increases and Medicare cuts in it. Thank you.
Thanks, everybody.
Thanks. Senator McConnell, do you think the Democrats have